What's going on, everyone? Welcome back to another episode of the Muscle Memoirs Podcast. Today, I'm very excited to be joined by Dr. Hana Kahleova. Dr. Kahleova, how are you doing today?
I'm doing well. Thanks so much, Mike, for inviting me. I'm excited to be here.
It's my pleasure. I'm super excited to get into our topics of discussion today. You've done so much great research in the field of nutrition. We have a good bit of ground to cover, I would say. But somewhere I want to start is a study that you completed a few years ago now, and that was comparing 2 large meals per day to an eating frequency of 6 meals per day. And this was a weight loss trial equated for total calories, and macronutrients were similar. And you saw some pretty positive results from this reduced meal frequency that I want to dive into. And before we get into the details, correct me if I'm wrong, but this was kind of like the first trial on early time restricted feeding before like we came at fond of this unique terminology. Is that correct?
Yeah, that's correct. You nailed it. And I mean, that was a super exciting study. I'm an endocrinologist by training. And when I went through my training as an endocrinologist, my heart was really going out to patients with diabetes. I came to the conclusion that the dietary recommendations they're getting is actually making their diabetes worse. And in terms of diet composition, restricting their carbohydrates, so mostly they're just left up with eating more meat and dairy, and that's making their diabetes worse and puts them at a higher risk of developing complications of diabetes. But also in terms of meal frequency and meal timing, with the advice of eating 5 to 6 small meals during the day, even second dinner. Like for people with type 2 diabetes who already struggle with extra body weight and who need to lose weight, this is a paradox. I mean, snacking as a strategy has been suggested for people for good body weight management and also for better glycemic control for people with diabetes. But when you see it in practice, some people do well with these recommendations, but most people just don't. And they stick to it. So I had patients come to me and they were like, I'm really sticking to all the recommendations. What am I doing wrong? And my diabetes is just getting worse and worse. And I was thinking, well, either my patients are like complete liars, like, most of them, or, they're really sincere. They're really doing what, what they're supposed to do, and it's just not working. So let's find out if we can find another way. There cannot be just like one way how to affect diabetes nutritionally. Let's just try what we can do to help them get their diabetes under control. And so we came up with this crossover trial comparing the usual 6 small meals during the day with only 2 meals a day, breakfast and lunch. And when we were applying for the funding at the Ministry of Health of the Czech Republic, the reviewers were even like questioning why we were doing the study. Like, this is a clear topic. Like, 6 meals a day will be better. So why are you even trying to do the study? Like, well, anyway, we got the funding. We were able to justify that it's maybe not as clear as the reviewers may think. And we were able to really show that 2 meals were much better for people with diabetes. They were losing more weight. They were improving their insulin sensitivity more. Their liver fat decreased more on 2 meals a day, which is a huge finding as well. There's no medication for fatty liver. There's no specific treatment for fatty liver. So diet and exercise are the number one recommendations. So if one way of eating really reduces the liver fat content more than any other way, that's a huge finding, because fatty liver is a risk factor for diabetes, cardiovascular disease, and of course, these were patients with type 2 diabetes already, at a much higher risk of developing cardiovascular disease than the general population. So for them, reducing their liver fat content is even more important than for general public. And so we showed all these positive outcomes in response to 2 meals a day. And now, some of the opponents were like, oh, that's great, people are losing weight, but I bet they were so hungry that just when the study ended, they were just eating everything they were able to put their hands on. Well, guess what? We were measuring the quality of life and also the feelings of hunger. And hunger decreased more on 2 meals a day, which was like a mind-blowing, finding. And it goes back to actually, confirming the previous studies that have shown that the more meals per day you're eating, the more you stimulate your brain and your hunger, and the more hungry you feel, which may be counterintuitive for most people. Most people think, well, when I eat small meals, very often, I will be less hungry. But guess what? Either you will overdo it with the portions and end up, eating too many calories and end up gaining weight, or if you really stick to small portions, then the downside of snacking is that you will never feel full. You will never be fully satiated. While on 2 meals a day, yeah, it was only 2 meals a day, but people were able to eat as much as they wanted. They were satiated, and they knew that there was a period of fasting, and the next morning, they were just looking forward to the breakfast. So, which is how it's supposed to be, because breakfast should be the largest meal of the day to synchronize our body clock. Uh, and yet, many people struggle with eating a large breakfast because they're not hungry. Why is it, right?
Right. I love that. I'm really looking forward into expanding upon those findings and discussing the research on meal frequency and incorporating extended durations of fasting outside of the usual overnight sleep period. Your point on, for a while now, we've been recommending this high frequency meal pattern for type 2 diabetics, and how, there are a variety of approaches that we can utilize to help attenuate these metabolic dysfunctions. I mean, even if we look at the most recent statement from the ADA, right, they basically state there are a wide variety of approaches that you can use for this condition, yet in the clinical setting, at least in my experience, in most hospitals, RDs are still just relying on carbohydrate counting and utilizing a moderate to high carbohydrate diet and frequent feedings. And the approach isn't being individualized to maximize outcomes in these settings where people are the sickest and they can probably benefit the most from an individualized dietary pattern.
Yeah, you just nailed it. And the good news is, even if you're, let's say, someone with diabetes, and you're getting only one advice at your hospital or at your outpatient clinic, you can always think about it as a short-term experiment, and just say, okay, let me try this new approach for a few months. Let me draw my labs, 3 months after I've tried this new approach, and see how it works for me, see how I feel, see what the outcomes will be, how my body weight will look like, how my glycemic control will look like. So you can think about it as an experiment. You don't have to commit to anything for the rest of your life, So And it's also a bit humbling for us who, provide some patient care and provide some advice. We know how difficult it is to provide some advice. Sometimes, you provide the best advice, and it's not working that great as you would expect. So you need to be more creative. You need to really tailor whatever is available to the patient's needs and their ability to follow. So it's, nutrition is complicated, but uh, the good news with all the technology nowadays, with continuous glucose monitoring for people with diabetes, we can really encourage them and empower them to try maybe a few different approaches and find something that will really suit them and that will really bring the results. Not only that it'll be comfortable for them to follow, but we need to meet some aims with the nutritional therapy of diabetes, right? And we want them to be losing weight. We want them to reduce their cardiovascular risk factors, the blood lipids and the blood pressure and the glycemic control. And all of these aims are important. So let's just experiment what works for people.
I really enjoy that perspective because I think people see the experimentation process a lot of the time as a failure, right? You always run into these individuals and they're like, well, I've tried these 3 different diets and like they didn't work for me. And they see it as, maybe there's something wrong with them, or like, again, they just see it as a complete failure, but rather it's an opportunity to learn because there are so many different approaches that can work. And but we can't determine on the surface which
Yeah.
approach is going to work best for someone. I mean, I just stumbled across a recent review paper looking at genome testing and trying to specify the diet related to those outcomes, and basically the results were null. They didn't really see a
Mhm.
benefit to that. So, I mean, if we consider that genetic testing at this point in time can't really figure out the individualized diet, then our best way to go about this is to trial and error and experiment and see what works for you. Use it as a learning experience, and we'll come across a pattern along the way that seems to fit your lifestyle and hunger cues the best, right?
Exactly. And with the approach of seeing any diet that's not working for me as failure, with this approach we would be without the light bulb today. How many attempts did it take for Thomas Alva Edison to invent the light bulb? More than 100. And he saw every experiment that didn't result in a light bulb as you know as another way how a light bulb doesn't work. So we can learn along the way. Before, we might be lucky. We might find out what diet works for us at the first attempt, and that's wonderful. But even if we don't, we will learn so much about our body and about our experience. We will be able to try out different foods and different recipes. We will learn a lot during the way. So it's not a loss. It's a gain.
Absolutely. Now let's take perhaps a step back and look at the literature at large as it stands today, as we analyze some of the details from your trial. And let's begin with talking about the potential benefits from shifting a larger proportion of calories to earlier in the day. In your specific trial, it was a large breakfast and lunch. Can you tell us what the specific time ranges were for those meals? And then we can get into other relevant trials that have been conducted more recently, finding some interesting things for weight loss.
Yeah, absolutely. So breakfast was consumed between 6 and 10 a.m., and lunch was consumed between noon and 3 p.m. Obviously, this needed to be individualized based on the schedule. Some people need to go to work super early. Some people are able to take their breakfast with them to work. So we were kind of flexible with the times. And most people in the beginning of the study were really afraid that they would not be able to follow it. It seemed to be so strict. Only 2 meals a day. They were like, I'm going to be starving in the evening. I don't know if I can do it. And what was surprising that, it from the very first day, they were super disciplined. We started each regimen, both the 6 meals a day and the 2 meals a day, with 5 days where we were together as a group. We rented out a hotel. We were up in the mountains. It was beautiful. And so it was also like a group support that we were able to give each other. In both of the regimens, it was important to know exactly what was required of them. So we had lectures during the day, but also some hiking in the afternoon and some chatting in the evening. It was a great experience. And I was expecting people to take it easy with the 2 meals a day, So the first day, when we had our breakfast and lunch, I put out some apples in the kitchen, on the kitchen table. And I said, well, if anyone's hungry in the evening, or if you're running into hypoglycemia, of course, then please pick an apple. And nobody needed one. The first day, I was in shock. I was like, is it even possible? I wasn't expecting it. And my participants were also surprised. They were like, this is amazing. Like, who would think of that? They were used to small portions during the day. And the reason why they were thinking they would be hungry in the evening was their experience of eating only small meals, never being satiated and being super hungry, a few hours after the last meal. But once you get enough fiber in your meals, things can change, and you can enjoy larger meals, and you don't have to be starving in the evening. And usually it takes people about 3 days to a week to adapt to the 2 meals a day fully without experiencing hunger in the evening. For the first couple of days, there's a component of our habit. If we're used to eating in the evening, we just get hungry, because that's our usual time when we eat a meal. But if we break that habit, within a few days, we usually adapt to the new system.
I'm really happy to hear that, because I think a lot of our listeners, they might be, hearing about these findings and getting excited over the prospect of utilizing some form of early time restricted feeding. But it does seem like it is very common for people to be consuming most of their daily calories later in the evening. Perhaps they're not eating much at work, and then they just come home after work and consume the vast majority of their calories. And for that reason, they get into these habits where, it's because I'm hungriest at night, and that's why I'm eating at night, when really it's just kind of this lifestyle routine that they got into. And so as a result of what you just told us, that can eradicate some of those fears, and that these hunger signals are adaptable, and as you change your schedule, you will adjust and fall in line from a circadian standpoint to training these hunger hormones to become more regulated with this new meal schedule.
Yeah, absolutely. And also the alignment with our circadian rhythms is crucial. We know that when we eat the same amount of calories in the morning and in the evening, it has completely different effects. More fat will be stored after the evening meal. So it's better for us to really maximize the energy consumption earlier in the day, rather than vice versa. And it has been shown that the melatonin secretion is more effective in the night when we're fasting. If you skip dinner, your melatonin secretion at night will be even higher. And that means that you will feel more rested in the morning. You will have more energy. Your immune system will work better. You will not get infections as easily, including COVID, potentially, although this approach has not been tested against COVID specifically. But melatonin has so many positive properties. It has anti-aging effects. It protects our heart. It has anti-inflammatory effects. It increases insulin sensitivity. It promotes our immune function. It's just, it's wonderful to keep our melatonin secretion high. And we know that melatonin secretion increases at night. So one of the first things we need to do is go to bed early. Because every hour before midnight counts as 2 hours after midnight, and that's really true for melatonin secretion. If you go to bed early, the area under the curve for melatonin secretion will be much larger than what you achieve after midnight. You can cut your melatonin secretion in half if you just stay up late. And if you go to bed at 2 a.m., even if the length of the sleep is the same, the quality of your sleep will not be the same. So it pays off to go to bed early. And if we skip dinner, we even boost our melatonin secretion. So
Those are
good
some
for your immune system.
Yeah, for sure. Those are some fantastic points that I think are really critical for people to understand, because I think it's become sort of common for a lot of quote unquote evidence-based practitioners to really just focus on dumbing down these principles of nutrition and reminding everyone, hey, what really matters at the end of the day is your total energy intake. And if you're in a calorie deficit, you will lose weight regardless of the timing of your meals and your calorie distribution. But it's not really that simple. Like it's true, but it's not. You mentioned a lot of extremely relevant details, and on top of that, we've known for decades now that in terms of glucose tolerance, it does seem to peak in the morning hours, and we see this progressive decrease in glucose tolerance over the course of the day, and this holds true for healthy individuals. I forget the author, but there's one particular study that comes to mind, and they looked at the glycemic response to a early lunch at 1 p.m. compared to a late lunch at 4:30 p.m. in healthy individuals, and just that 3.5 hour difference resulted in a 40% plus decrease in glucose tolerance, which is really important, right?
Absolutely. And another study from a German group from Professor Pfeiffer showed that especially for people with impaired glucose tolerance, it's really important to shift your meals earlier in the day because you're able to secrete your insulin more effectively in response to meal intake.
Awesome. I think now is probably a sufficient time to transition into another article of yours, and that was looking at the eating patterns and body composition outcomes over several years in the Adventist group. And can you elaborate on your findings there in regard to meal frequency and what the role that played in terms of body composition outcomes over a pretty long time span?
Yeah, absolutely. This was a fascinating study. We analyzed the data from more than 50,000 people who were followed for more than 7 years. And we were looking at how often and how many meals a day they were eating, what the meal timing was, whether they were eating breakfast or no, when their largest meal of the day was, and the length of night fast, and its association with how likely they were to gain weight over the course of 7 years. And what we found out was pretty fascinating. First of all, we found out that there was a linear relationship between the meal, the the number of meals eaten per day, and gain weight. Weight gain. That means eating more than 3 meals a day. That means snacking was definitely associated with weight gain. And relatively to 3 meals a day, 1 to 2 meals a day were better. People who were eating 1 to 2 meals a day were relatively losing weight compared to people who were eating 3 meals a day. Now, in terms of meal timing, breakfast was super important. Eating breakfast was associated with lower risk of gaining weight, and eating breakfast as the largest meal was one of the best options that people were able to choose from, rather than eating the largest meal as lunch and eating the largest meal at dinner. These people were the worst off in weight management. And the last outcome that we were looking at, or the last exposure we were looking at, was the length of night fast. How long it took from the last meal of the day to the first meal of the day. And we found out that the longer night fast was better for weight management. 18 to 24 hours a day was the ideal length of night fast. 18 hours, that's basically 2 meals a day, eaten about 5 to 6 hours apart. So that just confirms that eating 2 meals a day is actually, a super good regimen.
Yeah, I thought this article, the findings were absolutely fascinating. I think a lot of people have their qualms with observational research in general, but what might be interesting about this paper was that you were studying a very specific population that tends to have some pretty healthy habits on average. Is that correct?
Yeah. The Adventists are pretty health cautious. On average, they eat less meat than the general population. About almost half of them are vegetarians, or at least semi-vegetarians. Small portions are vegans. But a larger portion than in general population. In general population, it's like 1%. And in the Adventist cohort, it's about 7%. So, people are more health cautious. They also don't smoke. They try to take care of their health. Many of them exercise regularly. Typically, they don't consume any caffeinated beverages. So there's a lot of healthy habits. But in this health cautious population, we were able to show that meal timing and frequency really matters.
I love that. It's definitely important to bring up because I think we should be really confident in these findings considering the population studied. We mentioned here that from these results, there were benefits to a reduced meal frequency, 1 to 2 meals per day, as well as a longer fasting duration. Is it possible to tease out these details? What are your thoughts? Is the prolonged fasting just a consequence of the benefits that we might see with reduced meal frequency? Or would you say that extending that fast also has unique benefits and perhaps these two variables together were just compounding on top of each other for some pretty prolific results?
Yeah, I'd say it's both. We're kind of maximizing all the findings together. So, for example, we know that early time-restricted feeding has beneficial effects. We know that fasting by itself has beneficial effects. We know that reduced meal frequency can have beneficial effects. And so we just, put all these together And that's how we came up with the 2 meals a day, breakfast and lunch, with prolonged fasting, about 18 hours a day. So it's kind of maximizing the benefits that we know of from all the studies.
Absolutely. As we wrap up a few of these talking points and transition to another area of research that you've done an extensive amount of studying in, when we're looking at type 2 diabetics specifically, and we mentioned there's kind of this traditional notion that these individuals should be consuming small, frequent meals, and this might not be the best approach, and perhaps they could benefit from reducing their meal frequency. Can you kind of outline to our listeners where this traditional paradigm stems from? I mean, mechanistically, what was the rationale behind this approach? And then why might reducing that meal frequency improve glycemic control over the day?
Yeah, that's an excellent question. So first of all, this recommendation of eating small meals a day makes perfect sense if you eat lot of processed foods. If you just eat white bread, then it's probably a good idea not to eat a whole lot of it at once, because otherwise your blood sugar will spike. It's probably a good idea to just divide up the meals. um, but with increasing knowledge and with increased consumption of whole plant foods, with whole grains instead of just white flour products, with a lot of fruits and vegetables that contain a lot of fiber, with legumes, um, you know, we need to update the research and the recommendations as well. Um, so as the patients are able to transition to a more healthy diet, this will also impact their ability to, eat probably less frequently during the day, and will enable them to fast for some period of time.
Yeah, it seems like that some people might assume that, oh, I need to eat frequently if I have diabetes in order to prevent the potential of hypoglycemia. But if we're making better food choices and we're not just consuming white bread and processed carbohydrate predominantly at our meals in small portions, it's probably not something that should really be worried about.
Mm, exactly. Yeah. So it goes hand in hand. I always tell my patients, start with your diet quality. Start eating a healthier diet, and in the next step, if you're interested in eating 2 meals a day, go for it. But you need to start with increased diet quality first.
Awesome. Now, as we transition to the second part of the discussion, we're going to be diving into plant-based eating patterns, more specifically vegan and vegetarian diets. You just came out with a new paper on that, didn't you, within the last week or so?
Yeah, that's an exciting paper that was published in JAMA Network Open. And it was a study that included 244 people. So it was a pretty large trial. It was a randomized clinical trial looking at the effects of a low-fat vegan diet versus a usual Western diet for weight loss, but also body composition, um, the fat content in the liver and in the muscle, and the metabolism. Some these were participants in their 50s and 60s. The average age was 54 years. And at this age, many people are just complaining. When I was 18 years old, I was able to eat anything I wanted without gaining weight. And now it seems like I'm gaining weight from just breathing air. Man, can you do something about it? And, you know, it's probably more common than you think. At least, in my practice, people are complaining about it all the time, about their metabolism slowing down as they age. And I'm like, wow, well, let's see what we can do. Like, that's an important aspect, obviously, of age-related weight gain. So we know that vegan diets work for weight loss. Would they be able to even like speed up your metabolism? I don't know. That's why we did the study. And what we found out was pretty fascinating. So people were losing about 6.4 kilograms in 16 weeks on average. That's almost 15 pounds on average. And two-thirds of the weight loss was fat loss. So it really worked for in contrast to, for example, a keto diet where most of your weight loss will be coming from water and muscle. So this really worked for for these people who needed to lose some extra weight and for their improved body composition. It also reduced the visceral fat around the inner organs. That's the most metabolically dangerous fat. And it also reduced the liver and muscle fat. Now, why is liver and muscle fat so important? I would give you an analogy. When you're taking a bath, you may enjoy a full bath with a lot of water, and that's just wonderful. But if you overdo it with your water, if your water starts overflowing and it gets into your living room, you might get into trouble, because the damage that will be done might be just like irreparable, the furniture and the hardwood floors and the carpets, like, you don't know where to start when you come there. And it's similar with our liver and muscle cells. If there's too much fat stored inside those, because our adipose tissue has only a certain capacity to store fat. And if we keep consuming a lot of calories and mainly fat, then the fat starts overflowing to the inner organs like the muscle and the liver. And we can see it under the microscope. We can see the lipid droplets in the liver and in the muscle. And it causes insulin resistance. And insulin is a crucial hormone that lets glucose inside the cells. So if glucose is not able to get in because cells are not responding to insulin, it's like a jammed door lock where insulin is not able to open the door. Glucose cannot come into the cells. The cells are starving for energy while blood glucose is super high, and all the glucose is building up in the bloodstream. And that's pre-diabetes and diabetes. And one of our research questions in this study was, are we able to turn things around? Are we able to reduce the fat content in the liver and in the muscle? And so we were sending people to Yale University, to Professor Schulman and Peterson, who really started this method, who were the pioneers in this method. And so they're super experts, and we were so excited to work with them on this study. And we found out that after only 16 weeks of a low-fat vegan diet, the liver fat content was reduced by 34%. That's just incredible. That's super impressive. And the muscle fat was reduced by about 10%. And these improvements were also associated with improvements in insulin sensitivity. And now we're coming to the last part, to the metabolism. Are we able to speed up the metabolism? So the good news is that a low-fat vegan diet really increased the postprandial metabolism by almost 19%. It was by 14% in comparison to the control group. And it may seem like a small number, to boost your metabolism by 14%. It may seem like, oh, it's like a small change. But this happens after each meal. So the compound effect over a couple of years and over the course of your life, over a few decades, is just huge. Imagine you can eat 14% more calories without gaining weight. Uh, we calculated that it's probably a whole week each year of food. So that's your Christmas right there without gaining weight. How do you like that? How would you like just burning the extra energy in the form of heat? And that's exactly what our participants were able to do. They were able to burn more calories after they ate a meal. So yeah, these are our new findings, and I'm super excited to share them with you because these are just groundbreaking findings. What kind of diet is able to reduce liver fat by 34% without any energy limits? These people were eating ad libitum. They were getting completely full. They were not hungry. and and by the way, their metabolism was getting better, and their liver fat was reduced, and their body composition was improving, and they were losing weight. And you know it's just wonderful to see these changes in people's lives.
For sure. So there were some remarkable findings from this paper, and I would say these aren't in isolation. You've been a part of a couple other trials showing some pretty significant positive effects from a low-fat vegan diet. And this leads, I guess, into my primary question about this research, and that is, I think we can all agree that pretty much everyone could benefit from increasing their consumption of plants, and
Mhm.
plants should be at the center of any healthy diet. But are there unique advantages to taking that one step forward and following a very low fat vegan approach? And in this trial that we're talking about specifically, the control group was more or less following a standard American diet, right? So some people might look at these results and attribute most of the outcomes to weight loss, and even further just say, well, basically any whole food based diet is going to be superior to the standard American diet. But perhaps there's a little bit more to the story, and I would appreciate if you could fill our listeners in on if there are unique advantages to this very specific dietary approach.
Yeah, absolutely. This is a great question. So, we just finished a study comparing a low fat vegan diet with a Mediterranean diet. So, both of these are super plant based diets, with the Mediterranean being higher in fat, emphasizing the olive oil and nuts, and also including some fish and poultry and some low fat dairy. While a low-fat vegan diet seems to be super strict, right? It not only excludes all the animal products, so no meat, no dairy, no cheese, no eggs, and also limits the added oils. We were limiting the added oils, the added fats to 20 to 30 grams per day. And that's doable, but it may be a bit challenging when you're eating out, for example. So preparing your own meals is definitely, better for adhering to the diet. And while I'm not able to share with you the outcomes yet, in the next podcast, I hope the paper will be published so we can do another podcast on that. I can just tell you that starting each diet was a crossover trial, so each participant tried each diet, and starting each diet was like a little bit challenging for a few weeks. Like on the low-fat vegan diet, you need to figure out how to get rid of all the fat that's out there in the products. How to choose products that don't have so much fat in them, and how to cook without oil and all that stuff. On the Mediterranean diet, you need to figure out how to get in 4 tablespoons of olive oil a day. That's a whole lot, you know. So each diet had its specific challenges. But after a few weeks, all the participants were just able to do each of the diets. We were also measuring the food acceptability and how they were able to adhere to the diet. But once we publish the results, I'll be happy to share those with you. But to give you maybe just like a short answer, is it worth it trying a low-fat vegan diet, or is it like hardcore? Is it too extreme? Well, if you're getting maximum benefits from a Mediterranean diet, let's say, then keep doing what you're doing. If you're really improving, if you're losing weight, if you're reaching all the goals that nutritional therapy needs to accomplish for you, then fine. But many people reach a limit, and especially people who are overweight and who have the ectopic fat in the liver and in the muscle. In order to address the underlying insulin resistance in the liver and muscle cells, we just need to cut down the fat content even more for at least certain period of time. So these people will benefit from a low-fat vegan diet the most. So people with diabetes, people who need to lose weight and are not successful with more traditional plant-based diets that are more liberal with animal product consumption. So especially people with diabetes, people who are overweight, and people who have ectopic fat, like the fatty liver, and people with heart disease. These will benefit from a low-fat vegan diet the most.
Man, you really reeled me in there. We got half the inside scoop, but I was convinced we were going to get the full thing, and I'm really looking forward to seeing the results of this trial comparing a low-fat vegan diet to a Mediterranean approach. Yes, I think we will have to get you back on when that comes out to talk about that. But Dr. Kahleova, that does it for the questions I have for you today. I really appreciate your time. Thank you for joining me. For our listeners who want to learn more about you, go and support you, where can we point them toward?
So check out our website, pcrm.org. You can find many studies related to different conditions like diabetes or autoimmune disease, asthma, or rheumatoid arthritis. If you want to find out what kind of nutritional studies are out there for certain conditions, check out our website at www.pcrm.org.
And all of those resources will be in the show notes. But that does it for another episode of the Muscle Memoirs Podcast. Thanks so much for listening, everyone.
Thanks for having me, Mike.